Hello everyone, welcome back to my channel. If you are new here, my name is Dr. Surakshith Battina. I'm a gynecologist working at Indigo Women's Center, Chennai. And today we're going to talk about an essential vitamin that plays a very crucial role in fertility, which is vitamin D. In recent years, researchers have found a significant link between vitamin D and fertility in both men and women. In this video, we'll discuss about how vitamin D acts on the body, its benefits, latest research which is available, and statistics to show how widespread the issue of vitamin D deficiency actually is. But before we get started, it would mean so much to us if you could go ahead and subscribe to my channel and also hit the bell icon so you don't miss any of our future videos. Let's start with the basics. What is vitamin D and what are its uses? Vitamin D is a fat-soluble vitamin that is unfortunately only naturally present in very few foods. The vitamin is essential for the body to absorb calcium, which we all know is essential for bone health. Vitamin D also has a significant impact on the immune system, brain and the nervous system. It is also known to regulate the insulin levels and blood pressure. So now, how does vitamin D affect fertility? Vitamin D receptors have been identified on female reproductive organs such as ovaries, uterus and the endometrium. According to a small study in the Fertility and Sterility, women with low levels of vitamin D were less likely to conceive compared to those with normal levels. Another study published in the Endocrine Connections found that women are more likely to conceive with normal menstrual cycles when their vitamin D levels are balanced. Vitamin D also has a role in regulation of sex hormone steroidogenesis and modulation of reproductive process in both men and women. Vitamin D is essential for the production of testosterone, and a deficiency can lead to a decrease in sperm count and motility. A study published in the Journal of Clinical Endocrinology has found that women who have sufficient levels of vitamin D are more likely to conceive compared to those with a deficiency. Another study conducted by the University of Birmingham has found that men who have sufficient levels of vitamin D had better sperm motility and were more likely to conceive as well. According to the NIH, that is the National Institute of Health, about 1 billion people worldwide have a vitamin D deficiency. In addition, studies have found that up to 80% of women with polycystic ovarian disease have vitamin D deficiency. One study published in the European Journal of Endocrinology found that women with PCOD who receive vitamin D supplementation for 8 weeks experienced a reduction in the insulin resistance, which is a common symptom which is found in this condition. The study also found that vitamin D supplementation led to a decrease in testosterone level in these women, which helped them regulate the menstrual cycle and improve the fertility in these women. Another study that was published in the Gynec Endocrinology Journal had found that women who have PCOD who also received vitamin D supplementation for 12 weeks had an improved lipid profile, which can help reduce the risk of cardiovascular disease. However, saying all this, more research is needed to determine the optimal dosage and the duration of vitamin D supplementation for women who have PCOD. Aside from all the impact on fertility, vitamin D has many other benefits as well. It helps improve the bone health, it helps reduce the risk of osteoporosis. It is also known to help prevent autoimmune diseases and reduce the risk of developing multiple sclerosis. Additionally, it helps to regulate the blood sugar levels and also reduce the chance of getting type 2 diabetes. The amount of vitamin D you should consume depends on your age, health status, sun exposure and also other factors. According to the Institute of Medicine, the IOM, the recommended daily dose for vitamin D is about 600 IU per day for young adults and 800 IU per day for adults who are older than 70 years of age. However, some experts believe that these guideline values are too low and suggest that a daily vitamin D intake should be about 1000 to 4000 international units to ensure optimal blood levels of this vitamin. The Vitamin D Council recommends that the healthy adult should take about 2000 international units daily and more if in case they get little or no exposure to sun. So since there is no real consensus on the actual or optimal dosages for you, it's best that you talk to your healthcare provider before you start taking your vitamin D supplementation. So in conclusion, vitamin D plays a significant role in fertility, and deficiency in vitamin can have a significant impact on both the men and women. A healthy diet, exposure to sunlight and vitamin D supplementation is absolutely essential for you to maintain an optimal fertility level. That's it for today's video. If you have any questions or comments, please make sure you leave them in the comment section below, and don't forget to like, share and subscribe to my channel for more such informative videos.